Right, welcome back. We've got two more interviews to squeeze into these couple of minutes left on the program. Now, the increasing number of coronavirus infections at the country's mines has brought the spotlight into these working environments data from the Benchmarks Foundation. It's a research organization with a special focus in mining, and it shows a spike in infections since the reopening of these businesses, as well as when the country eased into the level 4 lockdown in May. Regional data is showing that the Northwest province on Tuesday recorded 84 new confirmed COVID-19 cases, the highest daily increase recorded in this area. And that brings the total number of cases to 271 at that point. Now, most of these cases are concentrated in mining districts. Now, in Limpopo, for example, the number of infections increased from 0 to 196 within the last 2 weeks in the mining areas of Sekhukhune, Capricorn and Waterberg. The foundation argues that though minerals make up around 45% of South Africa's exports, the mining sector only contributes 7% to GDP and is therefore not urgently needed to operate under the COVID-19 crisis. Well, Benchmark Foundation's lead researcher, David van Wyk, joins us to unpack more. Good to see you, David. Thanks for joining us.
Thank you, Leanne, and thank you for having us.
So give us a quick overview of why you're so concerned about the mining sector staying open at this point.
Well, I think that it's very difficult to maintain the necessary actions to make a mining workplace safe, especially with the deep level mines. You have a situation, for example, at Mponeng mine where you've got 5,000 workers, 2,500 of them having to report for duty every morning per shift. Now, how do you get those people down the shaft in the cages with them maintaining social distance? You cannot send them down 50 at a time. You want to get your shift going, and to get your shift going, you need to get your workers at the rock face as quickly as possible when the shift starts. So just in the cages themselves, a real problem with maintaining social distance. I also think that the conditions in the mines, especially the ultra deep level mines like Mponeng, for example, it is very, very hot underground. So it's very difficult for you to actually keep that mask on your face all the time. And when you are in a team working at the rock face, the work itself requires that workers engage with each other, and there's a lot of body fluids, spittle and sweat and everything else that gets spread around as these workers do this very heavy duty work underground. And so we're really not surprised by the fact that we see in the mining provinces, the areas in which there is mining, that is in Limpopo and in the Northwest, especially around Rustenburg, there are huge spikes from 2 weeks ago in the virus itself. And we noted at the start of the lockdown period on the 27th of March that the mine workers all went down to the Eastern Cape. They passed through Gauteng, which was the epicenter of the disease at that time, and we now see that the Eastern Cape is at number 3 in terms of the number of infections. And then these workers came back when we went down to level 4 and level 3 as the mines ramped up from 50% to 100%. And they passed again through Gauteng province to Limpopo and to the Northwest province on their way from the Eastern Cape. And now we are starting to see the epicenters of the disease starting to shift to the mining areas of the country. It is interesting because since we did the statistics yesterday, the figures in the Northwest has increased to 314 in a very short space of time.
Yeah.
From what they were yesterday.
So this is really moving. I mean, the figures that we quoted have now even moved higher. You're giving us an update in the quote. So there are more and more infections amongst miners at a time like this. And so just to bring your argument into this is that what you're saying is that it's not necessary to start mining and flood the global sector with platinum. This is that, but we obviously have to consider the economy. We need to kickstart it. We need to keep these jobs going because a lot of people were not earning money during the closure of the mines, and now they're going back and earning money, but at the same time, they're getting infected. What do we do? How do we balance this?
Well, I think first and foremost, we should have had a phased approach to reopening the economy. The low-risk businesses should have opened first, then medium risk, and then finally high-risk business should have opened last. We see that for the first time, gold and platinum prices are starting to move up due to the supply shortages and so on, which means that if we sustained the closure of the mines for a couple of weeks more, those prices would have gone up even more, and we would be able to actually benefit from very high prices in those particular metals as they increase due to the situation of the supply no longer flowing into the global markets. In 2014, the platinum industry survived a 7-month strike by AMCU, and it had very little impact on platinum prices at that time because there was such an oversupply of platinum on global markets. And the platinum prices never really recovered to the $2,000 an ounce that it was in 2008. It has hovered around $700-800 an ounce for the last 3 or 4 years. Now, clearly, it doesn't really make all that much economic sense to just rush to open the mines, and then you have to close them a few days later because they are infected heavily by the coronavirus. Mponeng mine, which is Anglo Gold Ashanti's mine, reported 200 cases according to the unions, 196 according to mine management. I'm getting messages from workers at the Two Rivers Platinum Mine in Limpopo, where they are very concerned that management is not being transparent with them and not following the regulations published by the Department of Mineral Resources in order to keep workers safe at those places. We speak to workers, including subcontracted workers, who travel between mines, and they say that the response of mining companies to the virus is very variable, with some companies doing really well and other companies doing not so well. The Tembelani mine in Rustenburg had 51 cases just recently, last week.
This is, a story that I just want to delve more into, but we've got to wrap it here. But you've given us some food for thought this morning, and hopefully we can follow up with you and keep an eye on these numbers and hope that something is done and that government can, do something about it. I know reversing this decision is going to be a tough one, but to at least understand and see the infection rate is climbing. So thanks. That's the Benchmark Foundation. It's the lead researcher, David van Wyk, discussing this alarming increase of COVID-19 infections within the mining industry. Apologies that we had to wrap that interview there because we've still got one more to get to you, and that's about the return of domestic workers, which is as important at this point. Let's take a break quickly.